Welcome to the Ticktective podcast, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your guest host today, Dana Parrish. I'm the co-author of the book Chronic, and I'm on the board of Bay Area Lyme Foundation. This program offers insightful interviews with clinicians, scientists, patients, and other interesting people. We're a nonprofit foundation based in Silicon Valley, and thanks to a generous grant that covers 100% of our overhead, all of your donations go directly to our research and our prevention programs. For more information about Lyme disease, please visit us at bayarealyme.org. Hi, I'm Dana Parrish, and I'm so honored to be the guest host today for the Ticktective podcast on behalf of Bay Area Lyme Foundation, of which I am a very proud board member. We are thrilled to welcome Dr. Ed Breitschwerdt today. He is the Melanie S. Steele Professor of Medicine and Infectious Diseases at North Carolina State University College of Veterinary Medicine. He is also an adjunct professor of medicine at Duke University Medical Center. And, you know, we could read a bio for you that goes on forever because you are so incredibly distinguished. You are the world's leading expert in many people's opinions on Bartonella, which is one of the main reasons that we've been brought together to talk here today. Thank you so much for agreeing to do this podcast and for being such an incredible ally and champion for this cause and this community, and such a diligent, brilliant researcher, and personally a friend. I really appreciate you, Ed. Thank you for being here.
Thanks, Dana.
How did you get into this world of Bartonella?
I became a member of the American Society of Rickettsiology. So, as a veterinary internist trying to understand rickettsia, I was welcomed, and a rickettsiologist at CDC, Dr. Russ Rigneri, at one of the national meetings, presented an abstract, and that abstract was to tell us as an audience that they had finally found the organism that caused cat scratch disease. And that organism was a Bartonella that becomes Bartonella henselae. And so the thing I always liked about Dr. Rigneri is he was a very basic microbiologist and rickettsiologist, and I was a clinician trying to understand the basic concepts of these bacteria and the disease they cause. So the next morning, we actually ended up having breakfast at the same table, and I asked him how difficult Bartonella was to isolate, and he said, if I could find 3 feral cats in Raleigh, I could come up with at least 1 and probably 2 isolates, which really says anybody that is very kind, very benevolent, and out there feeding and getting scratched by feral cats really needs to be careful. And we knew that 30 years ago now, when Bartonella henselae was first. So the initial research in our lab focused on Bartonella in cats.
As you and I were talking a little earlier today, I was one of those kids sitting on my front porch feeding the neighborhood cats and probably getting infected with Bartonella multiple times and not realizing it. And I had a lot of weird little things when I was a kid, and I had a period where I had ticks. And I had to get my adenoids out, my tonsils. I was the kid who always had stuff. So you're saying that, and it's really making me think. I'm glad you're saying this, and I'm going to call my mom after this and tell her she shouldn't have let me play with all those cats. She should have called you.
Well, don't blame your mom, because when you were growing up, we didn't know Bartonella existed on the North American continent.
Okay, I hear you. It's a really good thing though to say, because I have lots of friends with kids, and we all love animals, of course, and it's really important to say this because so many kids. I mean, I'm so concerned about the amount of Bartonella that's being spread from animals and from bugs, of course, but just innocently with no awareness. So it's good to bring the awareness to it.
We clearly are as well, certainly in the veterinary profession. And the thing that, anybody listening should know is that the current knowledge on Bartonella transmission from a cat to a human, it means that the cat has to have fleas, and it has to contaminate its nail bed, like a hypodermic needle, or its saliva, and then the Bartonella is actually transmitted. So the pathogenesis of this disease is that, the flea finds a feral cat somewhere, it gets a blood meal, it takes up the Bartonella, and then it produces large numbers of Bartonella in its intestinal tract, which end up in the feces. And then the cat, in the process of grooming, contaminates either, the mouth or the nails, so that it's likely that both bite and scratch transmission occurs, but scratch transmission is the one. So the take-home message is there's tons of very good, very safe products to keep fleas off of animals. And, as I say to veterinarians when I lecture, it's more important to do that today than it ever has been in the history of veterinary medicine.
I totally understand that. I can appreciate that so much. It's so diabolical when you describe how it transmits. They step in the litter box or they're grooming themselves, and you don't really, and also my friends who have cats, they walk all over the dining room table and stuff. I look at all that so differently now in light of this knowledge about Bartonella.
Well, I do as well. And again, as a veterinarian, one of the concerns I have in regard to Bartonella as a zoonoses, or the transmission from an animal to the human, is that we as humans have changed our behavior in regard to cats and dogs. And we've done that in a very, very short period of time. When I grew up on a farm, cats were never in the house, and dogs would only come in the winter when there was 2 feet or 3 feet of snow outside. So, but as you just alluded to, that's totally different than what exists today, where many people who have pets, they're inside all the time, or they're in the bedroom, or on the sofa, or on mother's lap. Yeah.
Well, do dogs carry we talked a little about cats, but do dogs carry Bartonella as frequently? And what is the prevalence, do you think? I don't know if the data has all been borne out, but what do you think prevalence?
Well, it's very clear that fleas and cats have co-evolved very effectively with Bartonella. So we know from published studies that cats that were buried with the pharaohs in Egyptian tombs 4,000 years ago actually still had Bartonella DNA in their tooth bed.
Wow.
Yeah. And so that tells us that this has been going on for a very long time. And apparently the ones that were sitting on the lap of the pharaoh probably had some fleas at some point in time, because they still had Bartonella in their blood. The prevalence in cats, varies. So if you're in Iceland and there's no fleas, the Bartonella prevalence is almost zero. If you're in North Carolina and you look at feral cats, which we have, it can be as high as 80%, where we can demonstrate the organism in the cat's blood. So any part of the United States that has a tremendously high flea density is going to have a very, very high prevalence of Bartonella in their cat population, unless the cats are kept indoor and they never get fleas, or their own products that keep them from becoming flea infested.
When I was living in San Diego, I know you and I spoke about this before when I was there, the flea situation there was like nothing I have ever seen. I would just walk down the street and get bitten in the middle of the street. And I spoke to the local ecologist who said, oh yeah, nothing ever dies here. I'll never forget. He just said, it's just the weather. It's why you love it here. And that's why it's also can be really, really difficult. They have all kinds of mites and weird things that I don't recognize from my many years in New York City. It's crazy. And now, I'm really careful with Lucy, because even in spite of all best efforts, she still would get fleas, and we're constantly bathing her, and I was getting bitten a lot. And I definitely am very, very concerned about that. And also for her well-being. Yeah.
So it reminds me of, and it's not the only case, but a particular case in which a young lady from Australia likely became infected by visiting San Francisco and staying in a hostel and getting so many flea bites on her legs that she developed a cellulitis. At that point in time, was hospitalized. She ended up back in Australia, and she actually ended up with a very unusual vasoproliferative tumor that we got involved in that testing of her for Bartonella, and proved that she had the Bartonella. So,
is she okay? Did she get a good outcome?
Yeah, she's doing a lot better than she would have been if they didn't know she had Bartonella.
That's Incredible. I didn't know about that. I do know, I have heard you talk about the prevalence. There's a study, right, about homeless population in San Francisco with a very
Absolutely.
high rate of Bartonella. Can we talk a little bit about that? Because that's interesting. And I also wonder if it, just as we're talking, if it plays a role, because Bartonella, and we'll talk more about this, causes so many neuropsychiatric conditions. And sometimes I wonder, did it actually, what was the chicken or the egg? I mean, what do you think?
So you're absolutely right that Bartonella was essentially discovered in the indigent homeless or HIV infected populations in San Francisco. And that's, well, in regard to North America, and I made this comment earlier, is prior to 1990, we did not know that a cat, dog, horse, human, or any other animal on the North American continent was infected with or potentially carrying a Bartonella around or being transmitted by fleas or flying mites or anything else. So, you know, the way Bartonella was actually discovered about 2 years, 3 years before Russ Brignery said Bartonella henselae caused cat scratch disease was through the fact that immunosuppressed individuals, so essentially people with AIDS, develop very unusual vasoproliferative tumors. And that's one of the reasons that we've looked at a vascular tumor in dogs that's called hemangiosarcoma, and we've looked at a vascular tumor in humans, which is the young lady I mentioned in Australia.
And where was that? And I'm sorry to interrupt, where was that in her body?
That was in her liver. Yeah. So its scientific name is epithelioid hemangioendothelioma. Yeah. And again, we don't know for sure that Bartonella causes it, but at least, you know, and Australia, England, and the United States, we've identified people who the physicians and the pathologists histologically diagnosed that cancer. And microbiologically, we documented that they had Bartonella in association with it. So it was because of AIDS, and it was because of these vascular proliferative lesions that were either on the skin or in the liver. If they're on the skin, they're called bacillary angiomatosis. If they're in the liver, it's called pileosis hepatis. But the real important aspect of that history is that at that point, nobody could culture Bartonella. And so David Relman at Stanford, out there in California, used DNA techniques. And the fact that these people were immunosuppressed, there were so many Bartonella growing in these tissues that they could separate out the Bartonella DNA from the host DNA and sequence it and say that it was either the old trench fever agent, Bartonella quintana, or this new bacteria that nobody had ever seen before or no sequence had been deposited in GenBank. And that was Bartonella henselae. There's over 40 Bartonella species, not strains, but specific species that have been accepted by the microbiologists in the world classification of bacteria.
And how many infect humans?
The current number is 18.
Okay. It went up from when we wrote an interview, when we interviewed you for the book, it was lower. I think it was like 14. Wow.
Yeah.
Wow. That's really interesting.
And that's, you know, that's an important point because the concern, Bartonella, and in my opinion, is one of the most important medical One Health problems that we need to work physicians, veterinarians, ecologists, vector biologists together to figure out what's going on, because one, it's transmitted by far more vectors than most of our tick transmitted diseases, or even our mosquito transmitted diseases. And it is in a much broader reservoir host out there in nature. So there's Bartonella in bats, there's Bartonella in rats, there's Bartonella in the ground squirrels that you have in California. There's literally Bartonella that have co-evolved with dogs, that have co-evolved with coyotes and foxes. There's Bartonella in squirrels and Bartonella in my cows on my farm.
Do we have to worry about ingesting meat that
I don't think so.
Okay.
Right now, I don't think anything that would end up in a meat product or any other product would be a means of transmission based on anything we know.
How about kissing? Kissing your dog? I mean, we know it's in cat saliva, right? It's probably in dog saliva.
Yeah, I I guess I would say that if one of my children or my grandmother was immunosuppressed, due to having, let's say, my grandmother has rheumatoid arthritis and she's on a variety of immunosuppressive drugs, I would just tell her to be a little bit cautious in regard to too much kissing and contact with saliva.
Yeah.
And if the dog had fleas on it, I would tell her to get rid of the fleas and no kissing of the dog until there were no fleas in the house. At this point, we clearly don't want to scare anybody, but also there's more we don't know about this genus of bacteria than we do know. And until we know more, now that we know it exists, now that we know that cats can carry it, dogs can carry, and they carry different Bartonellas, just like the squirrels have different Bartonellas. We just have to be a little cautious.
I agree. What about dog scratches? We talk a lot about cat scratches, but people get scratched by dogs too. Is that a concern?
So there are just a couple of cases of dog bite transmission in the literature. It's interestingly, there's cases that were just published out of Brazil last year on ferret transmission from a scratch, or actually the ferret was a bite and the guinea pig was a scratch. And the people developed what's called neuroretinitis. So neuroretinitis is a classic for ophthalmologists for Bartonella henselae infection. There's other things that cause neuroretinitis, but I'm not an ophthalmologist on the veterinary side and clearly not on the human side, but Bartonella is probably the most prevalent organism that causes neuroretinitis in humans.
And yet it's so largely under-recognized in medicine. I mean, I had a super bad case that caused heart failure and everybody missed it until I saw a specialist, obviously Dr. Phillips. But I couldn't get a diagnosis.
So what happened in human medicine is after Dr. Regnery made the association between Bartonella and cat scratch disease, that was solidified by a lot of studies. So there is no question that there may be another Bartonella in cats that's called Bartonella clarigiae that could cause a cat scratch disease presentation, but the vast majority of those cases, and what the literature prior to knowing what was really causing cat scratch disease said is that it was a self-limiting disease.
Right.
So that, physicians could treat it with antibiotics, but it didn't seem to make much difference in the course, and people immunologically eliminated the infection. So cat scratch disease, I should clarify, is three things: a scratch, a fever, because it's been called cat scratch fever, and developing a big lymph node.
Yeah.
And so usually if you get scratch on your hand, your axillary lymph node will enlarge, but sometimes you can get scratch on your hand and multiple lymph nodes in your body, including those in your groin, will get enlarged. And again, that's well established. But the next big thing that happened with Bartonella after we figured out, one, it's here, and two, it causes these vasoproliferative lesions if you're immunosuppressed, and it's the cause of cat scratch disease, was association with what's called culture negative endocarditis. And so Bartonella is so difficult to isolate, so difficult to culture, that even methods that have developed over the last 30 years, including those in our laboratory, have improved our ability to culture Bartonella, but it is still extremely difficult compared to most bacteria that would cause endocarditis. And so literally within a year, and the year was 1993, Bartonella quintana, which is transmitted by the human body louse in San Francisco and other areas where there are indigent people that are infested with the human body louse. Bartonella elizabethae, which is a rat-associated Bartonella, so somehow it managed to get out of a rat, get into a human, and cause endocarditis. And then Bartonella henselae became the third one, all reported within a year of culture negative endocarditis. I think the current count is there's 9 Bartonella species that have caused endocarditis in humans, including Bartonella mayotenensis, named for the Mayo Clinic, and tenensis for the French group in Marseille that characterized it. And it's in bats. So somehow this Bartonella made the jump from a bat to a human, ultimately resulting in localization and endocarditis. I would say by the end of the 1990s, we knew that Bartonella could cause enlarged lymph nodes in conjunction with or independent of cat scratch disease. And we knew it could cause endocarditis, and we knew it was more likely to cause recognizable disease if you were immunosuppressed.
It's been controversial to say, even though Bartonella has been found in ticks, for some reason it's controversial to then make the leap to ticks are transmitting it. Well, I got a tick bite right here, and this lymph node it was like a golf ball. I went to the ER, and it was so big that my internist said it had to be scanned, and my ENT at NYU at the time I was in New York said I had to come back every 3 months to make sure it wasn't getting worse. And I actually had 4 other glands surrounding it that were smaller, but this was so big and so palpable that it caused alarm. So this notion that it can't be spread by ticks to me is so weird, because it was such a direct correlation for me. But I've also heard about spider bites, and maybe we could just maybe you could just run through the list of vectors other than cats and dogs and fleas that can possibly spread this disease.
Yeah, so clearly we know that lice can, and the human body louse. We know that fleas can amongst rodents, amongst cats, amongst dogs. We know that sandflies can transmit Bartonella bacilliformis in Peru, and particularly in the Peruvian mountains. And that particular Bartonella has a very colorful history that goes back hundreds of years, in as much as it causes a very severe hemolytic anemia, and it also causes another vasoproliferative lesion. So it's called verruga peruana, and it looks just like bacillary angiomatosis in an AIDS patient. So probably after endocarditis, and I'll come back to the vectors in just a second, the next big area of Bartonella research and emphasis was actually associated with trying to understand, gee, here's a bacteria that can make blood vessels proliferate and can make tumor-like lesions. And if you treat the Bartonella, the lesions go away. So that became a major focus and remains a major focus of some laboratories in and around the world. So going back to the vectors, we clearly know lice, sandflies, fleas, keds, which are wingless flies, transmit Bartonella to deer and to sheep. Biting flies, so if you go to a stable and you see those flies, the horse flies that are biting the horses and all, they transmit to cattle and likely to horses. And we've reported, as you alluded to, a family with neurologic symptoms in Kentucky that the mother did a great job of documenting everything and took pictures of the spiders, took pictures of the bites on her children. And it was in they lived in an apartment at that point in time that had flooded. When it flooded, they got an infiltration of these little roly-polies or woodlice that if you pick up a board in North Carolina or almost anywhere, I think you can see them. And apparently there is a spider that I didn't know this until we got into this thing. That's called a woodlouse hunter spider. And spiders came into the flooded apartment where the woodlice had kind of proliferated. And that's how they got them. But the important part was we got the Bartonella henselae out of the mother, Bartonella henselae by DNA sequencing out of one of the 2 sons. The sickest son that she had called me about, we didn't we could prove he had antibodies, but we couldn't find the organism. And I think it's because they had him on high levels of IVIG at that point in time. Mm-hmm. And a year and a half later, after they had moved out of the apartment, the father actually went back and kept turning over sticks and logs and anything he could find, and sent us roly-polies and sent us wood lice hunter spiders. And Patricia Mascarelli, a postdoc in the lab, was able to prove that we had the same Bartonella henselae strain in the wood lice hunter spiders, and the two people that we could amplify and sequence it from their blood.
Wow.
So we don't know for sure. And this is where the controversy over tick transmission is. Nobody will accept tick transmission until it's done in the laboratory with Bartonella henselae. And there's a couple of those studies that are in progress, and we'll just have to hold tight and see what the results actually are.
Oh, well, I'm sorry. I didn't know you when I had my tick bite in my.
Yeah. We'd like to. We would have liked to have had that tick, because if again, what you developed is classic for cat scratch disease, and we could say tick bite disease. And we've actually seen that in a dog that presented to our college with a tick in its ear and a big lymph node in its neck. And what was so very interesting about that dog is the differences in the cytology. So it went from being a reactive lymph node, so they were doing aspiration cytology, to being a granulomatous lymph node, to being the third aspirate by the attending veterinarian. It looked like it was a cancer. And that didn't make any sense, because all this occurred within a 7 to 10 day period. And then when it was referred to us, it actually had a slightly different cytological appearance that looked like a giant cell tumor. And Bartonella causes giant cell tumors in children that the diagnosis is cat scratch disease. Now, unfortunately, I had read enough of that we tested that dog for Bartonella, and we proved that it had Bartonella, actually not henselae, but Vinsonii burkholfi, which was the first Bartonella that anybody in the world found in a dog. And that was our lab, because we were doing a lot of Bartonella work, and we studied a dog with culture negative endocarditis, and the PhD student in the lab made an isolate, and that ended up being a new Bartonella, and the most prevalent Bartonella that we find in dogs, in coyotes out in California, and to a lesser extent in foxes.
I have encountered several coyotes in the last few weeks. They're not interested in me.
They are not.
You've never seen me pick up the dog more quickly, and they travel in little packs. And right down my street, I'm up on a hill, and they just brazenly. And I'm talking 10 in the morning, 5. I'm not talking about dusk and dawn. I'm talking about weird times that you don't expect them. At least for me, I'm not used to all this nature. I'm used to living in a high rise with a bunch of cockroaches at the worst. So I'm learning a lot.
Well, and again, everybody can appreciate this with COVID and monkeypox, but what you just said is so important in the context of Bartonella as well. And actually all zoonotic infectious diseases. We're moving animals and infectious diseases around the world at a rate that's unprecedented in human history.
Yes.
And that's why, I think anyone who's in the quote infectious disease business is very concerned, because we need very good diagnostic tests. We need very good therapies for these things. And we need to be prepared for when the next one comes along that we don't actually know what it is. And, so those coyotes that you have in California were pretty much on the other side of the Rocky Mountains, like your side of the Rocky Mountains. They're now down the bottom of the hill on my farm in North Carolina.
Oh my God.
And they come across the entire United States, and guess what? They brought their Bartonellas with them.
Sorry about that. Sorry I didn't put up a California fence for you. I didn't know. Even in New York City, we would hear about coyotes in Central Park and occasionally making it into the city itself.
Absolutely.
And I thought that was, especially early in the pandemic when nobody was out. You remember those early days and the animals were like, this is our kingdom again. The people are home. And I would hear wild stories about animals in cities. And it's very, very, it is alarming, because, we're hearing about Marburgs, and now in Ghana, we are hearing about this all these horrifying infectious diseases that are springing up suddenly. Can you talk a little bit about what it does and the way it presents in humans and animals, and what do you think is most prevalent among the symptoms people should be looking at?
I think we went from back in the early 1990s, literally my research group studying cats and cat scratch disease, from believing that, only veterinarians or foresters or someone that had a tremendous amount of animal contact or a tremendous amount of arthropod contact, because we believed clearly that it was the ticks and the fleas likely doing the transmission, were going to be the people that became infected with Bartonella. And now I've changed my mind to the point that I wonder whether anyone can make it through life and not be exposed to and infected with this organism.
Yeah.
So, and like with cat scratch disease, I think the important message for everyone is the vast majority of people who are healthy and have a good immune system eliminate this organism at the site of the scratch. It never leaves the scratch. It never gets to the lymph node. It never becomes a systemic infection. Unfortunately, even with some people with cat scratch disease that we've studied, and there really ought to be a comprehensive study by one of our government agencies following people with cat scratch disease, as they've done with a national registry in Israel. So all the testing for Bartonella and cat scratch disease is done in a single laboratory. It's a state-run laboratory, and they actually have followed people for the next 20 years or so. And there are several publications that address that. So what's happened to those people? Some of those people have developed rheumatologic disease. Some of those people have developed other forms of kind of musculoskeletal pain. So the systems that we worry about the most are the skeletal system, the cardiovascular system, and the neurologic system. And on any given day, you really want all three of those systems to be working as well as they can be working, obviously. So you don't want any bacteria that can stay in your body for a long period of time. So you kind of asked this question earlier, and I didn't do a very good job of answering it, but literally, we all kind of went from the concept that only the animal that was a reservoir host, like the cat or the bat or the rat, would maintain the bacteremia for months to years. So we followed the same cat belonging to one of our students for 3 years, and we could grow Bartonella out of that cat for 3 years.
Wow.
And in a laboratory, we've done that for 18 months, where we actually infected cats, kept them for 18 months, showed that they remained infected, and then treated the cats to try to make the Bartonella go away. And I'm sure we'll get to treatment here eventually.
Did it work? Did the treatment?
No, it didn't.
Okay. Yeah.
So
we'll talk about that too, because again, nobody really talks about these things in the broader medical community. So
yeah.
No.
I mean, the cat studies that we published on treatment were probably 1998 or so, and we elected to treat the cats with doxycycline the same way we would treat rickettsia, ehrlichia, anaplasma, and some of the other important tick-borne diseases. And we were unhappy and somewhat shocked when, after 4 weeks of doxycycline, we could still grow Bartonella out of their blood. So that was the first lesson we learned, was that at least if it's a cat in a laboratory setting, doxycycline rarely cleared that infection.
Yeah.
And then we worked with Bayer Animal Health that had an antibiotic called enterofloxacin, a fluoroquinolone, and that worked better, but we still had cats that failed therapy with that particular antibiotic.
What about gentamicin? What about rifampin? Can you give these drugs? I know you can use them in people. Do you give these to animals, and do they work well?
Yeah, we, like in human medicine, we routinely use an aminoglycoside in culture-negative endocarditis. That's the primary indication for using aminoglycosides. There may be other indications.
We should just say that they're a class of antibiotics. I'm probably.
Yeah, I'm sorry.
I'm probably too much. Yeah.
Amikacin is the one that's used more often now because it's not as toxic, it's safer. But gentamicin. There's the class of aminoglycosides that are probably important when you're treating a patient that is septic from Bartonella and has a big infection in the heart valve, and you're trying to get that patient stable, and maybe go in and put a new heart valve in.
How well do these work, these drugs, when people have endocarditis or very severe neurologic, neuropsychiatric, rheumatologic conditions?
They actually work. And I think what has kind of evolved, and again, I don't want to comment on treating humans because I don't treat humans and I'm not licensed to be able to treat humans. I think if we look at the literature from human medicine and veterinary medicine, we've come to appreciate that eliminating Bartonella can be challenging, and that often it requires more than one antibiotic, and often it requires a very long duration of treatment, which is true for other intracellular bacteria with very slow dividing times, like Mycobacterium tuberculosis, which divides about every 24 hours like Bartonella does.
So it can really hit you like a ton of bricks.
Yeah, I think endocarditis is probably the hit me like a ton of bricks portion. The bad part about Bartonella is that I've come to believe that this bacteria does not want to hit you like a ton of bricks. And it's, as many of the physicians have said in their lectures, it's the host response as much as it is the bacterial infection that determines your symptoms on any given day. So I think you can think about this like, two boxers in a ring, and they're sparring and they're sparring and they're sparring, and, nobody's getting hurt, nobody's bleeding. And then one guy lands a pretty good punch and you've got a nosebleed, and then the other guy lands a good punch to the abdomen, and, that guy's bent over with pain. And then, so Bartonella, to me, if it established a chronic infection, and that's clearly what our research has shown, and that's what some of the Brazilian physicians are showing in immunocompetent people. Physicians, infectious disease physicians, accept the fact that Bartonella is a chronic infection of the blood in immunocompromised people. But they do not accept that at this point in time, at least most do not, that Bartonella can cause a chronic bacteremia.
Why do you think that is? Why is it so hard to have the reality of this recognized in the medical community?
Medicine moves very slowly, honestly, in regard to change. I think that's true of diagnostic tests. I think it's true of treatment modalities. And it's even more true when a new bug on the block comes around, so to speak, because everybody wants to really figure out, how real and how important is this new bacteria. And honestly, that has changed so dramatically for Bartonella in the last 30 years, from not knowing it exists to the situation in immunocompromised people, to cat scratch, to endocarditis, to our work. And maybe that's, again, it's because I'm a veterinarian, and because when I would lecture on Bartonella and what we were seeing in cats and dogs in particular, I would have veterinarians come up and say, "Can you test me?"
I'm so interested in what you found in veterinarians. I would think they would have such a high rate of exposure.
So they have a really high rate of exposure, with, depending on how many Bartonellas you test them against, of antibody prevalences of 40 to 50%, meaning, half of the veterinarians that are tested actually have antibodies to one of several organisms that we routinely see in cats or dogs. The more important part is being able to document that they have DNA of the organism in the blood of these veterinarians. And those studies have been around 25 to 28%. So we've done 2 studies in the United States and 1 study in Spain. The prevalence in veterinarians in Spain was a little lower, in and around 18%, but that's still phenomenal. We don't believe there should be bacteria in anybody's blood that a lab could document is present. And, I truly believe that the veterinary profession will become the canaries in the coal mine by which will the human medical professional better understand this genus of bacteria.
Would you say that many of these veterinarians were symptomatic? Did they describe, or did you see any patterns of illness or anything among them?
Absolutely. And I think the pattern that we've seen in veterinarians, we've subsequently seen when our studies opened up to test other individuals that were following the literature, their physicians were following the literature, and they asked to be entered into our IRB research project. So they often have fatigue and very severe fatigue, often memory loss, often difficulty sleeping. Statistically, agitation was one of the things that we found in the study that we did with Duke on the veterinary cohort that we looked at a meeting down in Florida, but the veterinarians were actually international that had come to the meeting. I think it was actually what we were seeing in veterinarians and what we started publishing in regard to neurologic manifestations or symptoms, I guess I should say, in the veterinarians that led us into starting to focus on Bartonella and neurologic disease, and particularly Bartonella and neuropsychiatric disease.
What about anxiety and depression? I think you said agitation and
actually, I shouldn't have said agitation. I should have used anxiety because that was the word on the questionnaire.
Very prevalent, right? And I would think,
yes,
knowing what I know from the humans that I know that have it, and what I went through, which was a complete falling off the cliff, was totally psychiatrically really boring and steady. And then all of a sudden, anxiety, depression, OCD, and I was seeing, I don't know if I ever told you this, but I was seeing melting monstrous faces every night when I closed my eyes. And what was so fascinating is Dr. Bob Bransfield, who I think is so wonderful as well. He's a psychiatrist, as you know, at Rutgers, and he's done a very brilliant body of work as well on the neuropsychiatric manifestations of vector-borne diseases. And I will never forget being at an ILADS conference, my first year being well and wanting to understand these diseases better and being able to attend this conference in Boston. I saw him present a slide where he talked about melting monstrous faces. And it was a common, Steve said it's not, Dr. Phillips said it's not like a hallucination specifically or I don't know how he categorized it, I can't remember, but this is common. And what's so interesting is my friend's son, who had the same thing, drew me a picture of what he was seeing in his head at like 9 years old. It was like the scream. I had the exact same thing. And it just, have you heard about this from other people? It's so weird.
We have definitely, documented patients with hallucinations, certainly with dramatic behavior changes, at least one case report with pediatric onset neuropsychiatric illness that led to a second study that we did that we just kind of opened things up. And when someone called that had a child or a young adult that went from being absolutely normal and absolutely healthy to having neuropsychiatric symptoms, we would enter them into our IRB study. It went for about 1.5 years. And in that period, there were 32 people that we studied. 29% of them either had antibodies to Bartonella or we could find Bartonella DNA in their blood. And 29 out of 32. Wow. And 22 of them, we could actually prove that they had Bartonella in their blood based on our enrichment culture techniques and PCR. So I have tremendous respect for Robert Bransfield, and he's done an amazing body of work. And I think Bob believes the same as I do, that we clearly need better tests to better understand the role of these vector transmitted organisms in neuropsychiatric disease. Because right now, that literature is just, it's in its infancy, literally where our knowledge of Bartonella was back in 1990.
That's a shame. because I feel it's playing such a huge role in mental illness across the world and in children. I'm really worried about kids. And I wanted to talk to you about some of the really fascinating cases I've heard you talk about and publish. The neuropsychiatric, I can't emphasize enough, like when you see your kid go haywire, even if we could talk about the slow boiling frog versus the runaway train sort of presentations. For me, I was the runaway train, but as you pointed out, oftentimes it's really a slow process between maybe infection, you get weird migrating low grade symptoms, they stop, you get a little fever here and there, a little joint pain, it stops. People don't understand that the migratory nature of these infections is one of their hallmarks. So you think, oh, I'm better now. Oh no, now it's my elbow, and that's kind of how it can unfold. But the brain stuff is so fascinating and so debilitating, though, too, at the same time, because it's not just brain fog and anxiety. It's full on to panic, like every cell of your body. You're just it feels like you've just become this different person. And I know from having a steady state of mental health, going through this and then recovering, that how fortunate I was to have seen the bite and to have known that it was the reason that I felt the way I did. And it would have been very easy to put me on psych meds. And doctors definitely wanted to put me on various palliative medications that would have just treated symptoms for joint pains and fibromyalgia kind of stuff. But just treating the infection completely resolved all of that. And I say I felt like I had monsters in my head. And I'm so curious about one of these cases that you presented that I think about so often is, I think it was an 18-year-old boy who was put in a psychiatric hospital. Can you talk a little bit about that case?
Yeah, again, one thing, Dana, I can say is, as an internist throughout my career, I believe that sometimes there's a single patient, a single dog, a single case that is just so pivotal in our understanding of what might be going on in the greater world out there. And a lot of really, really important discoveries in medicine started with one patient and one physician that, actually paid attention to that patient and just kept trying to push the edge of the envelope to figure out what was going on. In this boy's case, it was actually the father. His father would not accept that his son, a year and a half earlier, had been a straight A student, had been on the fencing team, had been the lead actor in several of the school plays, was a scholar, and just then started these, as you alluded to, very subtle behavior changes that got him to a psychiatrist. So the first, was that, well, maybe he's depressed or has anxiety. And then it just kept getting worse to the point that they finally diagnosed him with psychoses when he became, and he progressed from psychoses to being suicidal and homicidal. And we got involved literally about 18 months down the road when the father contacted me. At that point, and this is in the publication, which is in Central Nervous System Disease, the boy had literally failed combinations of 11 neuropsychiatric drugs for depression, behavior, all of that type thing. So it was what you said in regard to yourself, is that if you hadn't made the association between the tick and the lymphadenopathy, and what you were seeing in regard to the monsters, you would have been seeing a psychiatrist and you would have been treated for those types of things to see Absolutely. If they could help you make it go away.
And I never would have gotten better. But yeah.
Yeah. And that is a concern, because if we actually have an organism that we can identify and we can treat and go away. So the way the boy was ultimately diagnosed 2 months before we got involved is that after having been, as you alluded to several psychiatrists, to neurologists, having brain scans, having been institutionalized in a neuropsychiatric hospital for very detailed, intensive testing, ultimately, he went to a physician whose nurse saw a lesion that has been referred to as Bartonella trax.
Mm-hmm.
And that lesion caused the physician to start treating the boy for Bartonella. And he started to improve, but the father started chasing the literature on Bartonella because he had a target at that point in time. He ultimately found us. And still, after 2 months of doxycycline, so we talked about the cats failing a month of doxycycline. I've seen dogs fail 3 months of doxycycline clinically, and I've seen veterinarians who were seizuring fail 6 months of doxycycline and were still infected. So doxycycline alone, at least in a subset of individuals, will not clear the infection. So after 2 months of doxycycline, we could still demonstrate that the boy had viable Bartonella in the blood. And so at that point, the attending physician got involved with Dr. Bob Mosiani, who had worked with us and treated a large number of patients. And between the several physicians that were involved with his care, within 6 months, he went from 11 neuropsychiatric drugs to 1, and they were just afraid to stop that one.
Wow.
He was treated, we followed him microbiologically for about another 18 months. And I kept saying to his physicians, okay, when are we going to stop antibiotics? And I don't think either the doctors nor the parents wanted to stop antibiotics prematurely and have a relapse.
Of course.
And I think that was a good decision, because when they were finally stopped, he was back to being in school, getting straight A's in the play. And we're now 3 or 4 years down the road, and he is a student at The Ohio State University in his pre-med.
Wow.
At least the last email I had, he's doing extremely well and has had no relapses.
That is a great story. That's a wonderful story. I love those stories. And I think parents need to hear those, because, you know, so many parents are struggling with how to think about a future with a child who's going through pandas, so that, you know, these horrifyingly scary neuropsychiatric syndromes that their kids are having because of these infections. And I always think that Bartonella is possibly the main event in PANS, and it's not necessarily strep, it's not necessarily Lyme even, but I talk to so many clinicians that seem to feel this is a really big problem.
Well, I think the good news is that we've kind of reached a tipping point where there's a lot of people in human medicine and veterinary medicine that believes this genus is important enough that the NIH needs to start funding research relative to Bartonella, because right now, almost all the funding for Bartonella research is coming out of foundations. And, you know, I think if you go to the CDC website, you'll essentially see that most of what I've said so far about Bartonella is discounted by what's on the CDC website.
Yeah, well, this is a problem in Lyme too, as we know.
And I think, again, it's a problem where we're not keeping up with the change. And the other problem is we've got literally one laboratory that's a veterinary research laboratory that's trying to understand the medical implications of a genus of bacteria across all the animal species, including humans. And so, you know, that puts the problem into a nutshell. But there's finally some other groups, at least around the world, that are trying to look at Bartonella clinically, not as microbiologically and really basic science, understanding, you know, every protein and every pathway in the bacteria, which is important as well, because that's the basis upon which we build things like good diagnostic tests, good therapeutic tests. But we're building them we're building them and ignoring the fact that we need to understand the medical importance of this genus.
You know, one of the other things, you know, you touched on rheumatologic diseases. I'm not sure that everybody will even know what that means, but we should talk about that's arthritis. That's different. What are the kinds?
Absolutely.
To rattle off a couple of the associated, syndromes that can be caused, or that you feel can be caused by Bartonella.
Well, clearly we have tested both veterinarians and non-veterinarians who had a diagnosis of rheumatoid arthritis,
right,
and proven that they've had Bartonella, and they've been treated and had tremendous resolution in their joint symptoms at that point in time. The other rheumatologic disease is Ehlers-Danlos syndrome. And the reason I bring that up is, again, because of testing a veterinarian that was diagnosed with Ehlers-Danlos type 3 at Harvard, and saw a specialty group at Johns Hopkins that supported the Harvard diagnosis. And she happened to be a veterinary dermatologist. That there's probably nobody in veterinary medicine that has more contact with fleas and cats and flea feces than our dermatologists. And so she was one of the first patients that we got Bartonella cholerae. So this is another flea transmitted cat reservoir Bartonella out of. And she was treated and ultimately had complete or near complete resolution of her joint laxity and went back to being a runner again.
Okay, that's really great to hear, because I don't hear a lot of insights about Ehlers-Danlos, and I think it's often attributed to genetics when it's not necessarily genetic. People make a lot of assumptions there, but also they think, and I'm not saying can't be Lyme too, but there's also the collagen connection with Lyme. So I think there's also that playing a role maybe in some of these cases, but I did not know that Bartonella could be a cause as well. That's so good to know.
If you look at the manuscript that we did on that series of 32 people, and what we really wanted to emphasize there is almost 3/4 of those individuals, or at least 3/4, had skin lesions, and their skin lesions came on before or during their development of neuropsychiatric symptoms.
What do you mean by lesion exactly? Just visually, so we can.
Yeah. So this too has become a controversy, which is unfortunate, but it's I guess you'd say a fact of life. So many physicians, and we, in a couple of our initial case reports where we saw lesions that looked like stria, we called them stria, which stria densa is associated with stretching most likely, and defects in the collagen due to stretching. But they are stria-like lesions, except, they can occur on the arm in an area where something shouldn't be stretching. They can occur vertically, which is not across stretching planes generally. They can occur transversely across the thigh. And so there are linear stretch mark-like lesions that are more prevalent in Bartonella patients than we'd like to believe based on what's been done. And that's very little at this point in time, where it's been confirmed by PCR DNA sequencing or imaging by Marna Erickson, where she's actually looked at a few biopsies from these people and shown that within these stretch mark-like lesions, there's Bartonella DNA.
I've seen some of her slides, and I've been, in close contact with her for a couple of years. I'm blown away by what you find in the skin. And I'm blown away by the work. We don't have to get into this, but just thinking about Marna, melanomas.
What you bring up there is the Bartonella and cancer.
Yeah.
And, we did the microbiological testing in the melanoma group. Actually, a physician, Paul Riker, who is a co-author on the manuscript and was the primary one who contacted me and said, Ed, I'm seeing people in Oregon who have never seen the sun and have never taken their shirt off, and they have melanoma in places where there's no sun. And we all know that sun is considered an exposure risk for developing melanoma. And when Paul contacted me, he said, some of these people have a history of tick infestation, and I'm wondering if they have Lyme. And that's where that actually started. So he did Lyme testing through IGeneX and other laboratories that were doing that, but he did the Bartonella testing on a research basis through my IRB study. And it was a small number of patients in that study. You would consider it a pilot study. And then once that occurred, we went back and managed to get tissue blocks from where Paul had done biopsies on these people. And that's what Marna worked on to show not only did they have Bartonella in their blood, but they had Bartonella in the tissue. But that doesn't mean that the Bartonella caused the melanoma. All it means is we can find it in blood, we can find it in the tissue at this point in time.
So we don't know if it's causative.
That's right.
But it could be, I guess. And so it needs to really be explored. I remember talking to Neil Spector, who I know was a dear mutual friend of ours. Dr. Neil Spector was an oncologist at Duke, and he lost his heart to Lyme. And then he lived another about 11 years, and he passed away in June 2020, unfortunately, and was doing brilliant work with you on breast cancer and Bartonella. So can you talk a little bit about your work and your time with Neil?
Yeah, it's probably clearly one of the greatest honors of my life to have gotten to know Neil, to have worked with Neil. Clearly the most passionate physician, the kindest physician that anyone would ever want to meet.
Yes.
A brilliant mind and a very rigorous research approach, but a very open mind that was willing to encompass many, many concepts and try to see where those concepts actually fit into a picture that is called a patient and a disease. And so Neil and I initially met, and I explained to him what we were doing about, well, we were at a national meeting lecturing, and he came up to me afterwards and we started talking about Bartonella. And at that point, the only thing we had done in regard to breast cancer is we had a researcher send us cells from a very aggressive form of breast cancer that's called inflammatory breast cancer.
Yeah.
And their laboratory were making isolate of these cells to be able to study them, obviously with the permission of the patients. And when they were looking at their cells, they saw something in there that looked like bacteria. And when they did a silver stain, which is the only real stain that'll stain a Bartonella in a cell, the bacteria was still there. So they were convinced they had a bacteria, and then they asked us if we could figure out if it was Bartonella. And so they had two cell systems going, and both of them had Bartonella henselae. That was the story that I related to Neil. And then we started looking with Neil at what Bartonella does mechanistically in regard to breast cancer cells or non-cancerous breast cells. And the two cell lines that are the workhorse in our lab are a non-cancerous breast cell line and a dog macrophage cell line that's from a dog that had a cancer that and those are our real two workhorses. So the pandemic really interrupted research worldwide, and it complicated trying to get anything done and do it well. And so our breast cancer research literally got put on hold, but just stay tuned.
I want to hear about what you're working on now and what's happening with your research, because I know you never stop.
Well, I'm extremely excited about our research right now, and I'm extremely excited about the team that I have to be able to accomplish that research. And I'm most grateful to the Bay Area Lyme Foundation, to the Cohen Foundation for funding the research in our laboratory at this point in time. Clearly, they are the major funders of what we have going on in the lab. There are a couple other foundations that have contributed to our research in recent years. What has happened with Cohen Foundation is they have funded research for us to improve diagnostics. So in collaboration with Dr. Ricardo Maggi, who's a research microbiologist that many people have heard lecture or talk, Ricardo has pushed the envelope of being able to detect DNA of this bacteria in blood and in tissues. And then the other grant that we have is a collaboration between North Carolina State University, Duke University, pharmacology and chemistry, and Tulane University with Dr. Monica Embers doing the animal testing work on the products that are being generated, or I should say compounds that are being generated. So the whole goal of that is to take Neil's vision and Tim's expertise and our knowledge of Bartonella and a lot of the cell culture work that we're doing at NC State and put it together and come up with a very unique way. And Neil said this in one of the last lectures he ever gave, is we need to treat Bartonella like a cancer, and we need to approach its therapy like a cancer. And that's the approach the team's taking. Because of the diagnostic support of the Cohen Foundation, we were able to buy a piece of equipment. We are now utilizing that equipment in collaboration with the Bay Area Lyme Foundation, in collaboration with UNC, where we're doing 2 studies, one in children and one in adults. That will be an additional schizophrenia study with Columbia University and Brian Fallon's groups.
I am very grateful for the Bay Area Lyme Foundation and the Cohen Foundation for the incredible research that they're funding. They're all-stars, funding all-stars like you. I wanted to talk to you before we go, if you can, wouldn't mind just another 2-3 minutes to spend with me here about this COVID. I can't tell you how many times I've thought of you during the pandemic and wanted to call you up and say, what is going on with Bartonella and COVID? Is it being reactivated? I'm seeing such an overlap in symptoms, and I'm seeing Bartonella patients who recovered prior to getting COVID, maybe for long stretches they were well, get infected with COVID, go back down, relapse, get retreated for Bartonella or Bartonella and Lyme or whatever infections, and get better. So is long COVID not always like persistent COVID or some other mechanism? COVID is also chronic and persistent. I mean, there's like 300 studies now showing COVID's persistence. So I don't want to discount that.
Sure,
it's huge.
Absolutely.
It's a huge problem. But is it also activating Bartonella?
It's a very good question for which there's no data that I'm aware of. I have been very concerned since the onset of the pandemic. If 25%, let's say, using a round number of veterinarians walking around have Bartonella in their blood, and we did a blood donor study with physicians in Brazil using the techniques, the BAPGM enrichment blood culture that we developed at NC State and is now offered at Galaxy Diagnostics. And they found Bartonella in the blood of 3% of the blood donors in Sao Paulo, Brazil. Wow. So obviously you do not test sick people for your blood donors.
Right.
So as the techniques have gotten better, if that group can document and publish 3% of healthy blood donors, we know that there's a lot of healthy veterinarians that we can find Bartonella in their blood. And we know that there's a lot of sick veterinarians that we can find Bartonella in their blood. If we make the Bartonella go away, most of those veterinarians will have a much better quality of life.
Yeah.
But so I think Bartonella is far more prevalent in blood than any of us would have ever dreamed back in 1990 when AIDS came along and made us realize this bacteria existed. And if that's the case, Bartonella should be one of the primary organisms that's being targeted by COVID laboratories in the context of reactivation. But I don't know of anybody that's doing it.
I totally agree. And I don't see anybody even talking about it. I feel like I'm always screaming into the void because to me it's so clear. And it also, when I hear about the internal vibrations of all the long COVID patients, and when I hear about the tinnitus, and when I hear about the brain fog, it's just so eerily familiar. And I hope that we can get some of these clinicians to look for these bacteria, because I think patients will have a much better outcome. If, I did a talk on COVID 2 days ago and talked a lot about latent infections reactivating in the face of COVID. We know about EBV, we know about varicella,
Sure.
And that's great, but nobody's talking about the vector-borne stuff. And to me, that is a huge loss for the long COVID community, because I think broad spectrum ID panels should be done on every single long COVID patient. Let's see what's there, see what is treatable, and see who we can get better. Right now, they're all just being relegated to, physical therapy, nothing that helps.
And I think, several of the physicians that are active in regard to Lyme disease and Bartonella have strongly made the point that long COVID is going to help all of us, except the fact that you can have an infection that can cause different symptoms in different people, and most people will either not get sick at all, or they only get a mild flu-like illness. Some will get a severe flu-like illness, but some will get long COVID, which is like long borreliosis and long bartonellosis.
Absolutely. And you said something interesting about the CDC website. And one thing I noticed is that the animal side of the CDC website for Bartonella is really much better than the human side. They talk about chronicity, they talk about the different symptoms, and you look at the human page, it's like blank. It's self-limiting, which means it goes away on its own, you don't have to deal with it. And actually, I love looking at the animal stuff, because that's, to me, that's where it's at.
Dana, you've perhaps heard me say it in lectures, but from the veterinary perspective, the dog is the best naturally occurring model for human Bartonellosis, because dogs develop endocarditis, develop granulomatous lymphadenitis, they develop bacillary angiomatosis, they develop pileosis hepatis, just like the AIDS patients do. I think looking across the species has been a real benefit to me, no matter what infection I've looked at that was a vector-borne infection. How's it behave in a dog? How's it behave in a human? How's it behave in a cat?
Yeah, I've learned so much from you through the animal stuff. We've even talked about dogs herxing before. And that's because my dog has had Lyme. She's definitely had Bartonella. There's no question. And one day I took her to New Jersey to visit my parents. And it wasn't a trip for her to visit my parents. I was visiting my parents. I brought Lucy. They live in South Jersey, and it's suburban, leafy, tick-infested, deer-infested neighborhood, right? I know that now. 3 days later, she couldn't walk. So it was a very clear case of, and 3 days later, I also saw 2 ticks crawling up my wall in Manhattan. So there you go. Right. I gave her some of my tetracycline. I'm not kidding, because the vets wouldn't treat her for Lyme. They just didn't. It was weird. And I kept saying, well, she can't walk. I did $1,400 worth of x-rays and tests and blood work. Finally, I called my Lyme doctor and I told him about Lucy, and he's like, sounds like Lyme. And I had a little extra tetracycline and called my vet. I said, if I give her one, how much can I give her? He said, all right, fine, give her your tetracycline. She got better in 2 days. 11 days she couldn't walk. Just saying.
Understanding these diseases across veterinary medicine and human medicine, we've got a long way to go. But I think, to end on an encouraging note, I see manuscript after manuscript after big reviews and invited perspectives by authoritative individuals. And finally, something other than mosquito transmitted diseases is gaining traction. And ticks are number one. The bias is fleas need to be number two.
Yeah.
If not number one, because Absolutely. Those fleas are throughout the world on dogs and cats.
So my last question to you is testing. You actually are the CEO of a wonderful lab that I went to. That's where I got my diagnosis.
So the testing for Bartonella is complicated. And because it's complicated, it's not necessarily cheap. I'm not the CEO of Galaxy, but I'm the chief scientific
Ah,
officer.
sorry
And
about that. Yep.
no, it's fine. Dr. Amanda Elam is the chief executive officer of Galaxy, and I'm glad because she has to worry about the business side, which I try to stay out of 100%.
She's incredible. I just want to say that too. I think Amanda is a rock star.
She is a rock star, and Galaxy is super lucky to have her. And I guarantee you that Galaxy would not exist today if it were not for her, because prior to the pandemic and during the pandemic, there were many times where it was touch and go whether the company would still be in existence 2 months, 3 months down the road. And so, but I think, what Galaxy has tried to focus on, whether it's Lyme disease with the nanotrap test that's offered now for urine, what we believe is that the most important way for us to really be firm in a diagnosis is to be able to demonstrate antigen, a piece of the bacteria, protein of the bacteria, or DNA of the bacteria in the patient, in a tissue, in the blood. And so, the direct testing is far more expensive. And, again, when I lecture to veterinarians, we shouldn't throw serology out because it's really important. And every diagnostic test has limitations. And so that's why, whether it's IGeneX doing the testing, Galaxy doing the testing, I think all the companies want to continue to offer serology and the most sensitive molecular diagnostic testing they can offer, or antigen testing they can offer. And clearly, the tick-borne disease task force that's met over the last year, that is the #1 recommendation, and it's the reason for the LymeX initiative.
Yep.
To improve the diagnosis based on direct testing methods, particularly in acute infections, but equally important in chronic infections, where it becomes even more critical to patients.
Thank you so much. I love talking to you today. I have many, many more questions for another time. I can't thank you enough for everything that you do for this community and for the world, and just for your time today. Thank you so, so much.
You're welcome.
Is there anything important that I missed that you wanted to say before we go?
No, I think you did a great job of covering a lot of territory that's very complicated in a short period of time. And, I think maybe the last thing I would say is, during the COVID epidemic, one of the things that was very disappointing to me as a clinician that spent a good part of his career trying to do science, is that it seems like people have lost faith in science.
Yeah.
And that's what happened with COVID should be so reassuring, to go from a virus that we didn't know exist to a vaccine literally within almost a year of its epidemic occurring in the United States. If it wasn't for the science that had occurred in the previous decade in virology, we would have still been dealing with the initial part of this epidemic 5 years or so down the road before we had a vaccine. So I think it's really important. I understand if you're a patient and you're sick, and you've gone to a lot of doctors, that it's frustrating for the doctor. People become frustrated with their doctors. They become frustrated with science.
Yeah.
Honestly, all of us are trying to do a pretty good job of helping people. It's just not easy.
Absolutely agree. And I think the problem, unfortunately, was more the messaging from the CDC and various health agencies, and confusion around, do we need a mask? Is this just fomites? Is this airborne? I think that has really damaged really great science and great scientists. And I agree. It's a shame that things have become so divisive, and that scientists are not separated out from the political stuff as much as I think that they should be. But I'm glad that you mentioned that, because I think that's a really, really important note to end on. So thank you again for your time and for your expertise. And we'll talk again soon, I hope.
Thanks, Dana. All the best.
You too. Thank you so much, Ed. Bye-bye. Thank you for joining us for this episode of Ticktective, a program of the Bay Area Lyme Foundation. For more information and to get involved, visit us at bayarealyme.org.